from St. Louis, graduated from Rockhurst University in 1998. He received his medical degree from St. Louis University in 2002. We know age. He completed his internal residency in 2005 at SLU. A former lieutenant commander in the Navy, he was a staff physician at the Navy Hospital in Beaufort, South Carolina and Charleston, South Carolina during his 4 years of active duty service. He received his master's in business administration from Webster University in 2009. He returned to medical training in 2009 and completed his cardiology fellowship at St. Louis University School of Medicine in 2012. He is board certified in cardiovascular diseases as of 2012. So we're happy to have him. Thank you.
Sure. Thank you. Thank you everybody for coming today, and thank you NutriFormance for inviting me to give this presentation. So I'm born and raised from St. Louis. We talked about this when I met them the other week. I did go to CBC, played some sports in high school, played a little bit in college, and now I kind of try to work on people, trying to prevent them from ever really needing my services in the hospital. I've been in practice out of training for about 6 years, and my outpatient practice is pretty much 100% focused on prevention when I can get the patients who are interested in prevention to come through my doors. So today's talk is going to be probably a little bit different. I'm not going to talk about any pills or procedures per se. It's going to be more about lifestyle and things you can do to reduce your risk that you'll ever have a heart attack in the first place. But if you already have disease, there's lots of stuff that we can do that helps prevent you from having further events. So this was me last April with my wife. It was her dream to always go to Bhutan, so we hiked to the Tiger's Nest, which is this monastery built right on the side of a sheer cliff. So if you ever make it to Bhutan, definitely go check that out. All right, so I'm going to give you the quick and dirty. This is where the future is going to be, your mitochondria. So mitochondria, they're the organelles inside your cells that provide energy to your cells. The next 10 years in medicine, much of it probably will be focused on how well you can make your mitochondria function. Many people are concerned about, do they inherit certain genes from their parents? Are they going to get certain diseases, cancer, heart disease later on, because it runs in the family. But I'm telling you, it really matters, do your mitochondria turn those genes on or off? So the more you focus on mitochondrial health, the less likely you're going to be sick later on in life. So probably maybe up to 85% of chronic disease is tied into how well your mitochondria work. And let's see if this works today. Oh, there we go. Skipping ahead on me. All right, so if you want to eat your lunch or run, the 4 things, if you do these things, much less likely to see me in cardiology in the hospital any day. So 4 things. 1, get a lot of sunlight. Build up your vitamin Ds naturally. Optimally, try to get some morning sunlight. It resets your circadian biology. You make your hormones more optimally when you get some morning sunlight. Grounding or earthing, try to be barefoot in the ground. There's some reasons, we'll talk about that later. Drink some clean sources of water, and if you're really cool, block blue light like Bono or myself, and we'll talk about that. So 50% of the time, people's first symptom of heart disease is they drop dead or they have a heart attack. So, just looking at somebody, you can't tell, are they low risk or high risk? Tim Russert died, 10 years ago or so. He had abnormal testing 10 years before he died. He had a stress test within a year of him passing away at work. Bob Harper apparently looks very fit, dropped dead in his gym, was resuscitated, found out he had a severe blockage in multiple coronary arteries, and later was found to have something called lipoprotein A, which is similar to one type of cholesterol, but it's more what we call atherogenic and thrombogenic. Just means it's more likely to cause your blood to clot and more likely to develop plaque in your arteries. And it's not a test that's on your normal cholesterol test. There's 3 levels of prevention. There's primary, secondary, tertiary. So primary is you don't have any plaque in your arteries, and the goal is that you never put plaque in your arteries. Secondary is we look for a test that's non-invasive. Do you have asymptomatic plaque? Do you have stuff that's building up that you're not aware of? How do we find out that you have it, and then how do we prevent it from becoming active? I tell people this is kind of like finding a hidden volcano. As long as the volcano doesn't do anything, it's not going to cause you a problem. But if the volcano erupts, that's what a heart attack or stroke really is. Tertiary prevention, it means you've already had a heart attack, a stroke, you've needed a stent, bypass surgery. Well, what can you do to find out what led to that, and what can you do to prevent yourself from having a second or third event? All right, so I learned a lot of stuff from Dr. Mark Houston, and later if you guys want to see it, his book is probably one of the best kind of books to really explain integrative cardiology. His book is basically called What Your Doctor May Not Tell You About Heart Disease. I did a lot of training with him. I know the book inside and out, so I can tell you about heart disease today. But I did learn from him that there's probably over 400 causes of heart disease. And when I mean heart disease, it just means damaging your arteries that can lead to a heart attack or stroke. Everybody's probably well aware of high blood pressure, high cholesterol, diabetes, smoking, being obese as being risk factors. But those may be the top 5, but there's 395 other things that could potentially damage your arteries and cause a problem. So this is a schematic from Cleveland Heart Lab that's on the lab panel that I usually do with patients. And there's a progression. There's, from the screen left, there's a normal artery. Screen right is you have a blood clot in your artery. That's what a heart attack is. So, even when I was going through my initial training, sort of had the idea that your arteries are like plumbing systems, and that they would just fill up full of sludge, and then one day you have 100% blockage in your artery, and that's what a heart attack is. It's actually not that way. It's much more complicated, but not so much. It's that it's really about the health of the artery wall itself. There's data that once the artery gets inflamed or damaged, then that's when the cholesterol can become an issue. The cholesterol gets damaged, gets trapped below the walls of the artery. It's not such a big problem if you have a big thick cap over it and just kind of sealed away. It's kind of like a pimple that it's there, but as long as it doesn't get thicker and rupture, you don't form the blood clot. So there's many of these tests, we'll talk about them, that can kind of find out, are you more in this early risk, or do you have some of these higher risk markers where you're not necessarily a heart attack waiting to happen, but you're much higher risk than you may know about walking around. Something like Bob Harper. All right, so what do I do in my preventative practice? I do 2 things. I look for a structural issue, and then I look at the biochemistry. So if you've already had a stent, you've already had bypass, you're already high risk. If you've not had those things, just looking at somebody, you can't tell, are they low risk, are they high risk? So one test that I frequently will employ is something called the CT coronary calcium score. This is a $99 x-ray of your heart arteries, similar to like a mammogram. It's very low dose radiation, but it tells you, are you at risk, yes or no? You're not supposed to have calcium in your coronary arteries. Calcium is supposed to be in your bones and teeth. If you have calcium in your arteries, it means that the arteries are getting damaged, and that can be picked up on this x-ray. So what do presidents and astronauts have in common now? They all have to have calcium scores before they're in office or before they're allowed to fly. So Clinton had multiple stress tests when he was in office, passed all his stress tests, and within 5 years of getting out of office, had open heart surgery, and he's had some stents placed since that time. So since Clinton, every president has had calcium scores to tell them what their true risk is. Same way with astronauts. If your score is over 0, and we'll talk about the scores a little bit, they're deemed higher risk, and sometimes, unless they're mission critical people, they won't send them up if their calcium score is greater than 0, because you have a heart attack on the International Space Station, and there's not much they can be able to do for you. This is always a startling fact for many people, is that 50% of people who have heart attacks or strokes have normal cholesterol levels. So when somebody comes rolling into the ER with the classics, clutching their chest, having a heart attack, and we take them to the cath lab and fix the blockage, people are always like, oh, they must have really bad cholesterol. It's not always true. They have normal cholesterol many of the times. It's really going to be about inflammation. Inflammation is your immune system turned on and staying on, and if that happens, the cholesterol gets damaged. It's only when the cholesterol gets damaged do you have a big problem. So there's definitely more tests that you can check to see, what your risk is than just, quote, good and bad cholesterol, because there's really no such thing as good or bad cholesterol. There's just cholesterol. So here are some of the other risk factors, and these are some of the blood markers you can ask your physicians to check. The inflammatory markers are probably the key ones. If you're inflamed, you're more at risk. So I didn't list them all out because I didn't want to give you a cardiology dense lecture. I just want to kind of explain the basics and then what you can do from a lifestyle standpoint. But some of the blood markers, CRP, LPPA2, myeloperoxidase, all these tell your doctors where you're potentially inflamed and where you can kind of try to shut that inflammation off at. Yes, you can check your usual cholesterol profile, but there's something called particle numbers. If you think of cholesterol like oil and vinegar, the cholesterol is a fatty substance. It won't float in the bloodstream by itself. So it needs these particles to package them up like a little car and drive them around the system. The more particles you have, the more risk that one of these particles gets damaged, hits the wall of the artery, and plaque forms. So you need to know the particles more than you need to know the cholesterol. The Bob Harper lab, lipoprotein A, 20% of the population has that substance. It's very similar to LDL, but it's not treatable by lifestyle, medication, exercise, won't affect it. There's very few things that affect lipoprotein A. And people who have heart attacks or strokes in their 40s, 50s, or earlier than expected, many times you'll find lipoprotein A. You want to know what your blood sugar is and your 90-day average blood sugar. Metabolic syndrome or prediabetes is one of the leading causes for atherosclerosis. If your arteries are getting inflamed, it may be because your blood sugars are getting out of control and you're basically starting to rust your body faster than it should. Vitamin D, if it was discovered this day, it wouldn't be called a vitamin. It's actually more of a hormone. It affects every cell in your body, and vitamin D levels are extremely important for your immunity. So it's one reason why influenza is so common in the cold weather areas, is that everybody's vitamin D levels goes low, their immune systems are less active, they're more likely to get infections. So it goes along with heart disease, is that if your immune system isn't paying attention, you tend to oxidize or damage your cholesterol. Omega-3, that's what's found in fish. So you can take fish oil supplements. People will ask me, is it good or bad? It's good if you're trying to increase your seafood in your diet naturally, or if you're truly are not going to eat seafood, fine, but it's always best to get it in the package the way it was made. So we'll talk about seafood when we get to the nutrition part. And the genetics, there are genetic markers you can see that give you a higher risk, but as I said earlier, it's really more important what your mitochondria do to turn those genes on or off. Just because you have blood markers that are abnormal doesn't mean you necessarily have disease. You just may be higher risk, and there's things you can do from a lifestyle standpoint or nutritional standpoint that can help lower that risk. All right. So the target of treatment really is your endothelium. So the endothelium is one cell thick on the inner lining of your blood vessels. The endothelium is the air traffic controller. It basically tells the body what stays in the lumen where the blood is flowing and what can get into the walls of the artery. So certain nutrients are supposed to pass through, other things are not supposed to. So this is more for Ellie, is that I frequently use this as the tennis net analogy, is that your endothelium is like a tennis net. You have essentially 6 tennis courts surface area of endothelium in your body. It's one of the largest organs in your body. You just can't see it, and so you just don't usually think about it. But the healthier your endothelium is, again, the more healthy your arteries are. So frequently I'll tell patients that, if one side, this is where the blood's flowing and this is the wall of the artery. If the blood is flowing and it has big, fluffy cholesterol, LDL particles that are big, the big tennis balls are not getting through the net. If you have real small golf ball type of cholesterol particles, those are going to get through the net, more likely to form plaque on the other side of the wall of the artery. What are your odds of actually having an abnormal calcium score? So all comers who come in, 6 out of 10 are going to have a score greater than 0. If you have a score of 0, you're very low risk. It's not 0, but it's 0.4% over the next 5 years that you could likely have a heart attack. 1 in 6 comes in the door, will have a score over 400. That's a very high risk finding. Over 1,000, you pretty much have a 90% chance one of your arteries is going to be majorly blocked, and you're at very high risk of a heart attack. It was about a little year ago. I had done this test in a gentleman who was 47 years old or so, had a few risk factors, but not, didn't screen, this guy is excessively high risk. He had the highest score I'd ever seen in anybody, and I've screened people up to 80-something years old. His score was like almost 4,000. He ultimately needed bypass surgery. And surgery has its role, For him, it definitely was life-saving. All right, so what does your score mean? 0, very low risk. You're very unlikely to have blockages in your arteries. You still can have some soft plaque building up in your arteries. Not as common, but this is one of the most sensitive tests to tell you, do you have plaque in your arteries, yes or no? Essentially, I won't read it all to you, but the higher the score, it is somewhat logarithmic, the higher the risk. So if you have a score over 400, that's a big issue. You probably should be seeing a cardiologist to kind of discuss your risk factors. Under 400, many times your primary care doctor, as long as they're managing your other risk factors, you may be okay. But the biggest one is nobody really cares of, do I have plaque in my arteries or not? They want to know, am I going to have a heart attack? Am I going to die from this? And you essentially want to know, you want to be in the lower percentiles. So they'll grade you with this test compared to your peers, your sex, and your same age. If you have 90th percentile, that means that only 10% of people have higher scores than you. That's not very good. You want to be in the lower percentiles. The higher your score, now your risk is 4 times that of somebody who has a very low score. Who should get screened? Any man who's asymptomatic over 45, any woman over 55, or if people aren't those ages, at least have 2 risk factors or a good story. Again, if you have had this, if you've had a stent, you've had bypass, you've already declared yourself your high risk. This test isn't going to be beneficial to you. But if you're somebody who has not been known to have disease, this test can help you determine, is everything you're doing in your lifestyle, your supplements, your medications, are you really under as well control as you think? I frequently hear this one physician talk about people look like Adonis on the outside, but their insides are trashed. You can exercise like crazy, but if your arteries are getting calcified, there's still something not working in you. So you need to kind of find out what that is and reverse that. All right, so I started with sleep is the best, I shouldn't say the best, but is the number one thing that people should try to focus on from a lifestyle standpoint. Sleep is absolutely critical. Sleep is more important than nutrition. Sleep is more important than taking most supplements by leaps and bounds. Sleep is when you repair yourself. If you don't sleep well, you're not going to live a long life. So if you do all the hard work in this gym, breaking yourself down, it's when you sleep is when you repair that damage and get stronger so that you can go back to the gym another day and build up stronger. If you don't sleep well, you won't get the benefit from the exercise that the people who do sleep well. So things that can help sleep is you have to work on having good sleep hygiene, have a sleep routine. Anybody who has kids knows that you can't just take a kid who's roughhousing in the living room and throw them in bed and say, time for bed. There has to be kind of a wind down period. You can have the bath, tell them stories, tuck them in. You should try to have a similar routine. Maybe it's not an hour long, 15, 20 minutes. But once you get to your place where you sleep, I tell people try to make it like a cave or make it like a campsite. You want it to be dark, cool, and quiet. And try to minimize any technology in that space. There's some interesting information about people keeping their cell phones by their heads, causing nightmares and all sorts of sleep disturbances. So if at all possible, keep your phone in airplane mode if it's anywhere near your head. Otherwise, try to keep it about 10 feet away from your body wherever you sleep. The further away from your phone, the less the radio waves from the phone or the Bluetooth from the phone can affect your mitochondria. So in my bedroom, my phone, if I'm on call, I have it on a dresser that's across the room. Get up in the middle of the night if it goes off, And I personally shut off my Wi-Fi at night. Might be crazy to some, but you don't need Wi-Fi. There's some data that the Wi-Fi might interfere with your mitochondrial health as well. So I just have my Wi-Fi router on a switch, and so when it's nighttime, just flip the switch, the Wi-Fi goes off. So it's like a cave. All right, minimize blue light, because I'm wearing the glasses. So blue light isn't really blue. It looks white when it comes off these monitors and fluorescent lights. So blue light in of itself is not bad when blue light comes from the sun. The sun is usually balanced with blue, red, and green. Your body knows what to do with that. So when you go outside and you look in the direction of the sun, that blue light in the morning turns on your hormone cascade in your brain, tells you it's morning time, make your sex hormones. You start making melatonin in the morning time. Melatonin, everybody thinks about it as being the hormone that helps you sleep, It does do that, but it also is critical. The more melatonin you have, the better you can repair your mitochondria in the evening time. The more melatonin you have, the less likely you will have cancers. So, and it's not the same thing as taking a melatonin capsule. It's much better to build it in your own system. And the way you do that is through your eyes getting blue light from the sun, not from your iPhone or your laptops. So when you're outside, you don't have to really protect your eyes with blue blocking glasses. But when you're inside, the technology, the blue light that comes off the technology is 4 times the intensity of the sun. That basically tells your body it's noontime all the time when you're looking at your phone or screen in your bed. So what I try to recommend to patients who have difficulty sleeping, or anybody who really wants to have healthy eyesight as they age, is basically wear indoor sunglasses. If you're using technology, consider wearing blue blocking lenses. But if you need to sleep better in the evening time, once the sun sets, thousands of years ago, all you had was campfire, candles. That's the light that your body's tuned into, amber and red. If you put in blue in the evening time, your sleep will be disturbed because blue light directly destroys melatonin that you've been building up all day. You need about 4 hours of darkness for melatonin levels to start rising again. So some people can fall asleep, but they wake up at 3 o'clock in the morning and can't go back to sleep. One of the reasons can be they've destroyed their melatonin from too much blue light from their technology. So some quick fixes are wear the glasses. There's a program called F-Lux or Iris for the computer that can dim out some of the blue light from the screen. And then that's on the iPhone, they have that night shift mode. You can program it, and so your phone naturally gets dimmer in the evening time. And then snoring, I'm not a sleep expert, but because I'm so focused on sleep quality, it's a question I'm always asking my patients. So if your spouse or somebody, your kids tell you snore like a freight train, that increases your risk of a heart attack by 30%. There's not too many diseases that aren't impacted by poor sleep quality. So if you're snoring, you should consider getting a sleep study to evaluate, do you have sleep apnea? Because if you have sleep apnea where you stop breathing, that puts a lot of stress or strain on your heart. Get your apnea treated, you have less risk of a heart attack. Okay, exercise. So I'm not going to be the one who describes that, you need to do X number of cardio, X number of strength training. Movement is going to be beneficial, but what I'm going to talk about more is the kind of recovery phases from exercise. So both of these are obviously great athletes. Both have been number one in their sport, but I won't talk about the extracurricular activities, but what's the major difference between the two? From my standpoint, is that Federer rarely broke down, where Woods has been out multiple times. Why is that? I actually had the privilege of meeting the physician who was both of their doctors at one point of his career. And he's like, Federer is hyper-focused on recovery. So he will train very hard, but he will recover, and before he goes back out there and hits again, he's doing all these metrics to prove that he's recovered. Where Woods had really poor sleep quality and would just get up in the middle of the night and go run a 5K at 3 o'clock in the morning because he couldn't sleep. Destroys melatonin, destroys his sex hormones, ends up getting really bad back disease at 41, 42 years old. So recovery is hyper important for longevity in your sport or life. One thing that you can do to monitor your recovery is something called heart rate variability. Your heart rate should not be 70, 70, 70, 70, 70 like a metronome. The healthier you are, as you breathe in, the heartbeat should get further apart. As you breathe out, they should get closer together. So you can actually measure the time between heartbeats. That is a measurement called heart rate variability. The better your heart rate is able to do that, the more fit you are and the better recovered you are. So one thing you can do is there's multiple apps, but you can get a Bluetooth chest strap. I actually have a watch one called Zoom that can do it. Wake up in the morning, before you do too much activity, sit down, run the little app. It's usually between 1 and 5 minutes. And then it gives you a morning number. This is your heart rate variability. I'm not religious about it in training, but when I was doing a lot more training, I would. And if my number was bad that day, I either decrease the intensity of the exercise or push the date off to another date. Because if you overtrain when your HRV is bad, you're just more at risk of getting injured or overtraining, and that's when bad things happen from a cardiovascular standpoint. It's just a side note, like people always get, I should say, concerned, but you see an ultramarathoner drop dead of a heart attack. It's like, he was so in shape, how could this possibly happen? It's, if you don't allow yourself to recover, your arteries will get highly inflamed and you'll develop plaque just like somebody who does no physical activity or eats poorly. So you need to let the body recover from the damage you did from the exercise. You don't get the benefit from exercise until you recover from the exercise. All right. Let's see if my slides will start working. There we go. All right, nutrition. So yes, you somewhat are what you eat, but I'm not going to go big into vegetarian, veganism, paleo is better than the others. It matters much more your light environment and your sleep quality than exactly what you put in your system, but you want to be putting in high quality stuff into your system. But my 3 top tips are, we'll start at the bottom. Drink clean water. Your body is 99% water. The better sources of water will help you make energy from the food you eat, and that's activities you go outside. You need water to kind of make these cellular reactions happen. Big in people eating seafood or shellfish for the DHA component. That's one of the components of omega-3. The DHA is very healthy for brain function, but it helps lower inflammation. And without DHA, your mitochondria don't work very well. And then the other big one is eat seasonally for your location. So there is no perfect diet for every single person around the world. It's all contextual. So wherever they live in the world determines what is a more optimal diet for them. So people who are Inuits and the original Eskimos living way up north, there's not a lot of fruit and vegetables way up north. They ate mostly seafood, blubber, and they had very little heart disease. People in the tropics eat almost significant portion of it is more vegetarian. They're in a high light environment, high meaning there's a lot of UV light year round. They can kind of burn off that sugar and the calories from, I'm being a little bit incorrect medically saying burn off calories from it, but essentially eating a bunch of sugar in the Caribbean isn't as big of a problem because of the light environment that they're in. All right, stress. Everybody has stress in their life. You have good stress, you have bad stress. And it's how you react to that stress determines, does it cause a downstream effect? So stress is kind of a balance between your autonomic nervous system components, the sympathetic and the parasympathetic. So sympathetic is your fight or flight response, so the saber-toothed tiger is chasing you. The parasympathetic tone is all about your rest and relaxation. Many people get stuck in they're highly sympathetically driven and they never get that rest and relaxation phase. So when you're chronically stressed, your blood basically gets stickier, your blood sugar goes up because that stress raises your cortisol levels, which raises your blood sugar. And when you have high levels of adrenaline, your arteries constrict. When your arteries constrict, that raises your blood pressure. So hypertension or high blood pressure really isn't a disease. It's a secondary effect of something going on in your system, and it's your job to be the detective to go back and figure out what's causing it. Things that can help with stress, meditation, yoga. I usually teach people the box breath, 4 seconds in, hold for 4 seconds, 4 seconds out, 4 seconds. So 16 to 20 second cycles, do 4 or 5 of them. When you do that type of deep breathing work, you're putting your parasympathetic tone higher and driving the sympathetic tone down. So you're trying to put them more in balance. Another thing you can do to kind of monitor your heart rate variability, but also your stress, is doing something called cardiac coherence. There's a device that the heart math people make. It plugs into your phone, clips to your ear, measures your heart rate, and you can basically see, is your brain and your heart talking to each other in a nice way or a way that's very unhealthy. So I've probably meditated for about 2 years, mostly used the Headspace app. Some people like it, some people don't. Some people say my mind wanders too much. Heart math is a good way to determine if you're doing it correctly, because some people think that when they meditate, is it working for them? that's an individual question for everybody. But with HeartMath, there's actually real-time feedback. If you're breathing right, your heart rate variability improves, you get a green dot. If you're not doing it right, it drops down to red. So you immediately can know how to kind of correct that deficiency. And this is really my second to last slide. I'm going to answer all the questions people may have, but it's a very old Chinese text that we learned from some of my teachers. The superior doctors prevent the disease, the mediocre ones treat it before it's evident, and the inferior ones treat the full-blown disease. So, I'm very good at treating people once they have the heart attack, but I prefer not to use that skill set. I'd rather use the set of trying to make you optimal and lead the life that you want to lead without sickness. So, I work at St. Louis Heart and Vascular. We have a couple different offices. I do the calcium score test at this office for $99, 5 days a week. And then, if people are interested in consults with me or doing any of these advanced blood testing, I'm more than happy to see you for a consult. That usually is kind of a two-part visit. You come meet me, get to know what your history is, what your interests are. We find out what tests are appropriate for you, get the screening done. Usually takes about a week or two to get results. You come back, sit down with me, about an 8-page handout, and I go through it line by line, say, your risk fall here, and these are things you can do with your lifestyle, these are things you can do with your supplements, and if you're on medicines, which medicines are more optimal than others. Medicines have their role, but there's, frequently people get into there's a pill for every ill. I have high blood pressure, I take a high blood pressure pill, that's fixed. I have high cholesterol, I take a high cholesterol pill. Those are band-aids. They're just not, they're not fixing why you had those issues in the first place. So that's really what I like to do is root cause medicine, and I'll kind of open it up to any questions anybody has.
Do you want me to go back to the previous slide?
Oh, I was curious. Yeah, I was just gonna.
You were trying to get it. The next slide.
No, sorry,
She's
Chinese
taking a
squash.
picture.
Yeah, thank you.
Thank you. Quick thing, we have 10% off all of our supplements, including vitamin D for Heart Month. I know a lot of people in here take vitamin D, including myself. It really helps. And we are lucky enough to also have our Metagenics rep, Emily Smith, who is so smart in the supplement world. Can you address the fish oil that we do sell because it is so pure? Real quick, just because I love the eat real fish, but
Correct. Not everybody eats it as routinely as they should.
exactly. So you can speak it better than I can.
Right, and I agree with Dr. Twyman 100%. Food, your sources should always come from food first. But we know that in a lot of cases that we do need extra, which is why it's called supplements. It's not first line of defense. But with the fish oils that we use, they are the highest quality. We test for all types of microbes, funguses, heavy metals. We are actually finding that people are getting more and more exposure to heavy metals because think about what the fish eat. They are eating other smaller fishes that are getting a lot of metals from our oceans. So we do extensive testing. We actually do third-party testing as well. So because some students, oh goodness, well, of course their tests say that they're high quality, but we do third-party testing too, especially on these. So these are highest quality and we get great results. So thank you for the opportunity. Thank you, Dr. Twyman. This was amazing. Go ahead.
Do you have to have a physician referral to get the $99 test?
No, that test is walk-in if you prefer. You don't even need an appointment. Takes about 5 minutes. You don't need an IV. You don't need any blood work at a time. You don't need a fast. Typically, if you come in and tell them who your doctor is or who you want a copy of the report to go to, they will take that information down. Typically, if somebody comes in without a doctor's order, it gets ordered under my name and the report comes to me. But every patient that comes in will get a copy of the report, and there's basically a 2-page summary. Similar to what it has, your score is this, you're high risk, consider these things. But you get that information, you pay for it, your information, you take it to whoever you want. I typically recommend people, if their score is over 400, being biased, they should probably sit down with me and figure out what's going on with their life to try to prevent them from having events.
Is this the mode you were talking about, night shift? So how warm or less?
I turn it all the way to less. Make it look yellow, but I'm
My 14-year-old is wondering why she's waking up at 3 o'clock in the morning
this is
every night.
this is a huge issue with millennials and issues because they're texting
Until
them
they go to bed.
and they go to bed and they put the phone down and they don't sleep well. And if they don't sleep well, they don't, tend to function well when they're at school the next day or in their sports, they're not doing as well. So this is a big problem in teenagers and college kids.
So you schedule this for like maybe 8 PM this goes on, or 6
at a minimum, I mean,
So
I'm
when do
hardcore
they
about
turn
it
off
that-
the computer altogether?
Yes, I mean, optimally you don't have any screens after sunset, but that's not possible generally. So my niece is not a big fan of Uncle Mike's. Every time I come over there, they have night shift on their iPad and all that stuff. He's like, oh, I can't see stuff so good. I was like, well, do you sleep better? Like, sleep is more important than your screen being bright at nighttime. I have it so that in the evening time that, yes, I basically have night shift on my phone 24 hours a day because I don't need it at the bright colors. If if you're taking professional photos, you need to see the true color saturation. We'll turn it back on and look at it, but then turn it off. I actually have a yellow screen protector, so that I'm hardcore sometimes about some things. But this helps. I'm on call sometimes, and in the middle of the night, you don't want to open your phone up at 3 o'clock in the morning to look at a text message because that will instantly tell your brain it's daytime, it's noon. Even if you turn it back off, just that few seconds of looking at it, it's going to start messing up your hormonal cycle. So, it's hard to just, I don't wear glasses normally, I wear contacts, so it's hard for me in the middle of the night to think like, oh, put on blue block glasses, get out phone. So I just put this over the top of it.
Where does ultrasound scanning come in? Does that come into any analysis that you do?
Yes, it depends on. So ultrasound is a very good modality for looking more for disease once it's present. Ultrasound isn't as great for looking for screening type of tests. So the two main ultrasounds that I would typically do are heart ultrasounds called echocardiograms that looks at the heart function, the valves. You typically don't do that just for screening purposes. Generally, you're short of breath, there's chest pain, there's palpitations, somebody's heard an abnormal heart sound, insurance will then cover that test. Ultrasounds of the neck can look for plaque at a later stage. There is a more advanced ultrasound of the neck that can look at the thickness of the arteries. I just don't yet have that technology, so I don't typically talk about it because I don't want to promise something that I can't get just yet. But ultrasound is a very good screening because you have 60,000 miles of blood vessels. If you find plaque in one of those 60,000 miles, you likely have it in the other area. So if you find plaque, some of the most odd places I've ever seen plaque build up is that I actually saw a dentist today, and he taught me this trick, is that on panoramics of your teeth, you can actually see calcium in your carotid arteries on that. If they see that, you have atherosclerosis, you have high degree of risk. You should probably go get screened. So you can get picked up on just getting teeth checked out.
Well, you can see the calcium deposits on the x-rays.
In your carotid arteries sometimes. Or for women with mammograms, if you see calcifications in the breast tissue, that's another marker of vascular disease. You got a question, man?
I was curious, the vitamin D part is like during the summertime, you're really better and you're out a lot. But is it possible to have like too much vitamin D in your body? Is that?
It is possible, but I can tell you that that's the extreme. If there's 100 people, maybe one's gonna be too high and 99 are low. So I don't tend to worry too much about the high end so much, but you definitely can over supplement and get your vitamin D levels up. This is on camera, all right. I've only had 5 patients with scores over 100 on their vitamin D levels. So for everybody, just get on the same page. Under 30 on the vitamin D level is deficient. Now where optimal is sort of depends on what you're trying to be optimal for, but for cardiovascular disease, I typically shoot for a level between 50 and 60, but at least greater than 30. But of 5 people who scores over 100, I was one of those 5 people. So I stopped supplementing with a lot of extra vitamin D. I definitely agree people should be taking vitamin D in a St. Louis winter if they're not doing any traveling going further south. So there's actually an app called D, like the letter D, Minder. It's free. It's for iPhone and Android. I routinely recommend it to my patients because it's outstanding at giving you an idea of what is a safe level of sun exposure. So, the sun is not all good, it's not all bad, but without sunlight, you're not going to do well. A figure analogy is, if you throw a tarp over your bushes out back, how well is that bush going to keep growing? It's not. If you wear clothes and hats and sunglasses and sunscreen 24 hours a day, you're not going to be optimal either. So what is a safe level? Depends on what your skin tone is to begin with, but 10 to 15, 20 minutes a day is probably going to be beneficial for you and not cause any long-term effects. D-Minder is really good in that it takes into account your latitude, where you're at on this earth. It tells you the time of day that vitamin D can be made on your skin. So today it was like 950 to somewhere like 130. So St. Louis is now getting out of vitamin D winter. There's about 2 to 3 months in St. Louis that you will not make vitamin D if you went outside, no clothes on, you won't make vitamin D because the sun, its angle off the earth is not going to make, yes, you'll be very grumpy. And this is why people's moods and everything get messed up in the wintertime. So D-Minder app actually can tell you how much sunlight you should get in the day. There's like a little timer. You're like, I'm outside now. I'm done being outside. How much vitamin D you made on your skin. You tell it like, okay, my face, my arms, my legs are exposed. I got 30% of my body exposed. This is how much vitamin D you have. And if you do blood work with no sunscreen, for the
What if
first,
there's no sun?
there's still, depending if there's like clouds, you'll still get like 40 to 50% of UVB will make it through the sun. So you still make some. So, yes, there will not be, it's not Colorado where we're going to have 300 days of blue sky in St. Louis, but you'll still make some even when it's gray out. And yes, without sunscreen on for that first 10 to 15 minutes, once you got your, vitamin D medicine in, then, I would actually prefer people would just, go in the shade, put long sleeves on, put hats on, and use physical blockers instead of putting chemicals on their skin. Because whatever you put on your skin is going to get into your bloodstream for the most part. So if you wouldn't put it in your mouth, you probably shouldn't put it on your skin.
So sitting in front of a window during wintertime, do you still get vitamin D sitting in the sunshine?
The window blocks most UV radiation.
No,
So,
that's the point.
right. So there are certain plastic windows, like they're not plexiglass, but you can get certain windows. So it's more common in Florida. People have them in their kind of, I don't know what they would call them here, but like their sunrooms, where the glass would be this plastic. Well, then UV rays can actually make it through there. So sunlight has different wavelengths. So certain wavelengths are real short, certain ones are really long. The real long ones can get through glass. The real short ones get blocked by glass. So most eyeglasses, sunglasses are going to block UV light. So that's another good point, is that you do not want 24 hours a day UV light blasting into your eyes, but you need a couple minutes a day of UV light not looking through your glasses to turn on this sensor in the back of your eye called melanopsin, and there's ones on your skin called neuropsin. If you block your skin all the time, that UV light doesn't get to it, you don't turn on these signaling things that turn on certain hormones through the day. So what I tell people if they wear actual glasses is when they go outside, just tilt them down and let the sun get over their glasses. So.
You mentioned right at that second slide, grounding.
Okay.
This is only the second time I've ever heard that, so.
Sure. So grounding, or earthing is the other thing that can be called. This isn't something that you can learn in mainstream medicine. This isn't something I was taught in medical school. And it's something else I didn't believe for the longest period of time. But there are studies coming out. Dr. Steven Sinatra is somebody I learned a lot from. He's kind of like the original integrative holistic cardiologist. And he has actual published studies on earthing, helping with lowering inflammation. It's somewhat of a natural blood thinner, and it just helps with overall energy. So the actual science behind it is that when you're barefoot on the Earth's surfaces that are man-made or not man-made, so grass, sand, it can be rock, but if it's asphalt or oil, that'll block the message. So here's where it gets into the physics, and I won't explain the nitty-gritty of it, but essentially the sun sends out the wavelengths. The Earth is also getting struck by lightning thousands of times a second. all that energy gets absorbed by the earth. The earth is full of these negative ions because of the electricity. You take your shoes off, you stand on the earth, you basically become a battery between the sun and the earth. You accept electrons from the earth. Those electrons help lower inflammation. Here's where it gets even more crazy, is that, people will get into the battles of, the food gurus, this camp is better than this camp. But all food ultimately, people always want to talk about carbs, proteins, and fats. All that stuff in your body ultimately gets broken down into electrons and protons, and that's what gets fed to the mitochondria. So you get electrons from your food source. So when you are way up north, you need to eat a whole lot more food because you need more electrons because there's not sun up north. When you're on the equator, getting sun, 12 hours a day, because there's always a 12-hour day on the equator, you don't need as much food because you literally are getting electrons, energy from the earth. It sounds insane, but when you actually do the reading about it, or just do your own self-experiment, I know for myself, I went to Mexico 2-3 weeks ago for the entire week. I didn't wear shoes when I was outside. I sat on the beach, feet on the beach. I don't think I ever felt like I wanted to eat lunch. I just ate lunch because we were supposed to eat lunch. And normally, here I'm hungry 11 o'clock. It's time to eat. So my own experiment, getting a lot more sunlight and grounding, I wasn't nearly as hungry as I was. So play around with it yourself. So either I'm crazy telling you to do it, or it's going to work without any harmful effects.
Field trip.
Yes.
Now, with back to the computer at night, if they won't turn it off at sunset, how many hours prior to going to bed would it be safe to use your computer or your TV?
So it's a distance thing. The closer it is to you, the worse it is for you. So that's why an iPhone or iPad close is worse than TV. But the more time, the better. Melatonin needs 3 to 4 hours to really be released from the centers in the brain that it needs to be released for.
3 to 4 hours?
So in the days prior to artificial light, so artificial light didn't come to the late 1800s when Edison and Westinghouse and Tesla all invented the different light bulbs. Typically, unless you had whale oil or candles, the sun set, you weren't exposed to much light, and with 3 to 4 hours of the sun setting, you were tired enough to go to bed. Now you can light your house up 24 hours a day. Some people can get away with it easier than others, but people who say that they sleep really bad or they wake up in the middle of the night, it's not always going to be a blue light thing, but you'll be surprised how well you'll sleep and how well it may fix it quickly. If it fixes it, outstanding. If not, there's more detective work you can figure out what's causing it. But if you came to my house, I go even more in depth. Did I know all this light stuff? I didn't know this light stuff 6 months ago. I taught myself this all in the past 6 months. But I have the very bright LED lights in my house, the white crisp ones, so it looks really cool. But I don't try to turn those on once the sun sets if I can help it. And then in my kind of living room area, I have the F-Lux or Iris on my computer, and then I have I tend to wear my glasses when I'm using them. So, but I also have, I said earlier, your eyes are tuned to red and amber. So actually, you can get them at Home Depot and Lowe's for under $10. You can get Edison-style LED bulbs that just put out red light. So you can still read by red light. So I have a room in my house that looks like a submarine. So
So when you go to sleep, you should have a red light on instead of a...
You shouldn't have any lights on, if at all possible. But correct. But if you're going to read in the evening time, and you just don't want to be bumping into things, having an amber or red light won't interfere with your melatonin being released.
So it should be more warm.
It should be as yellow as it can go, like that. So it always looks weird when you first see it, and now the phone looks weird to me if it's bright white. But honestly, I used to be very big into, more just kind of focusing on exercise and nutrition, and they're still extremely important, but I'm getting more into, getting back outside like you were meant to be outside, and avoiding the light at the evening time when your body wasn't supposed to be exposed to it. If you do those two things, you'll be surprised how many things get fixed. You may not even have a disease or problem, but that has a diagnosis you're going to see a physician for, but you'll just notice your sleep quality is better, or you recovered faster from that exercise routine. Something will probably change in your life if you kind of focus on getting some sunlight outside and not being exposed to the technology light in the evening time.
How do you kind of balance the risk of skin cancer due to excessive sun exposure with achieving the right amount?
Well, that's why I mentioned there is a balance, but I mean, but it's swung a little bit too far where everybody isn't the right word, but people get too afraid of getting any sunlight, so they get 0, and then they have vitamin D levels of 10. And then when you have low vitamin D levels, your immune system doesn't work, and there's all sorts of data that low vitamin D is associated with breast cancer, colon cancer, all these other cancers. And so it's not a either or type thing, but if you have low vitamin D, you're much more likely to have all these other cancers, but you're maybe not going to have basal cell or the other types of skin cancers. It's actually more common to get melanoma in areas that don't see the sun than it is areas that have the sun. So the sun is a drug in ways, and you need the right amount of dosage. But yes, that's why I say, use the D-Minder app, because it can really dial in, what is a safe exposure for your skin type. So, in the back.
2 questions.
Sure.
What's the name of the meditation app you were talking about?
The what? Oh, sure.
And then what should we be thinking about for the youth today that are overtrained, they're staring at their phones, bad posture? What are we going to see with them in the future? What can we prevent today, I guess?
Sure. So the first question is, I personally use an app called Headspace. It's Andy's the guy's name. He was a former Buddhist monk, and now he does these meditations. Headspace is a free app for the first 10 sessions to play around with it. There's another one I have, Calm, but I don't really use that one. But if you end up liking Andy's app, and I don't make any money recommending him by any means, but if I don't hear Andy's voice in my head every day, I feel like it wasn't a real day. So Andy has a very good way of introducing people to meditation, and you don't have to meditate for 2 hours on the side of the mountain like I was trying to do in Bhutan earlier last year. But any type of meditation just helps with the oxygenation of your cells. You're learning how to do deep breathing and just decreasing your cortisol levels, getting your stress levels down. Now back to your other question. That is a really, really good question. And if you really want to be a preventive cardiologist, you basically have to treat children. And there's nobody really set up to do that at this time. I think the heart rate variability is probably one of the easiest and simplest thing you can get people to sort of do and see where their numbers are at. And then the other thing is, checking their kind of sex hormone panels, testosterone levels. So, testosterone naturally kind of declines as you age, but if you overtrain and you're in a blue lit technology world 24 hours a day, especially on more boys than girls, is they'll have much lower levels of testosterone than biologically they should be having. So you can see it in their hormone panels if their lifestyle is really affecting them. Now what to do about it? The biggest thing is, I don't like saying when I was a kid I was always outside, but in ways, yes, that is sort of true. You were outside a lot more. I played video games as a kid, but it wasn't nonstop, and I didn't have this technology in my face right before I was trying to go to sleep at night. So I think if you could help them focus on their sleep, that would be critical for how well they're going to recover whenever they're training at the gym or doing their sport. There is another thing I didn't talk about, that is this ring called Oura, O-U-R-A. This ring is I tell people it's like a fancy Fitbit. It does all the usual fitness tracking, but it also does sleep tracking. It measures your heart rate as you sleep, it measures oxygen and temperature levels, and it has an app that works with your phone that tells you essentially, are you in light sleep, REM sleep, or deep restorative sleep. Is it 100% accurate compared to a sleep study? No, but it gives you a lot more data than wearing your Fitbit is for your sleep. Because honestly, I don't think the Fitbit sleep one is all that accurate. I mean, it just tells you if you moved or not. This is actually measuring physiologic parameters to determine what your sleep cycles are. And basically every day it gives you a different score. The quick way is, essentially before you get out of bed, is just give your scale like 1 to 10, like before you got out of bed. How well did I sleep last night? If you feel like you can get up and go run your marathon or do whatever you're supposed to do that day, you probably slept well. But if you feel like, I want to be in bed for the next 2 hours and I'm not going to exercise today, maybe there's something that was really wrong with your sleep quality. What did you do the day before that potentially wrecked it? If you had a stressful fight with your spouse, or you're working on a big work project till 10 and you try to put your head down at 10:05, it's probably not going to work well for you long term. You can get away with doing stuff short term, but your body won't tolerate it long term. But the kids are definitely an issue. Is trying to keep them outside more, do a lot more of their exercises outside when they can, and avoid the blue light once the sun sets.
Thank you so much.
Very welcome.
I'm sure